Hi there. We are live on Pride Pages podcast, and I'm here with Dr. Becky Gomez here in Boise, Idaho. She's a nurse practitioner with, how do you pronounce it?
Mangum Primary Care.
Mangum Primary Care. Welcome to Dr. Becky Gomez.
Thank you.
So when and how did you become an advocate for the LGBTQ community?
Okay, I really had to think about this question. So I actually grew up in Burley, Idaho, not very far away from here. It's a very conservative small town in Burley. And I was raised in a very dominant conservative religion. So growing up, I don't think I knew any gay people, any people who were LGBTQ. If I did, it was only through whispers, people that I heard about. So having grown up that way, and having grown up in a very conservative religion, I had an experience of working with a lot of youth in this church. And a lot of times I had an experience of working with a youth that I was pretty sure was part of the LGBTQ community. And once they turned adults, most of them did come out as adults. And so that was helpful for me to go, okay, I recognize this and I saw this in childhood. And this is how they were born. This is innate. This is not something that they chose to, things that I was taught growing up. And so that was really helpful for me to be able to see and recognize that and go, okay, this is part of who this kid is. This is just part of them. So in 2008, my church got heavily involved, or the church that I grew up in got heavily involved in Prop 8 in California, which was basically working to ban gay marriage. And I didn't understand that. I couldn't make sense of trying to prevent equal rights. That's where I just started having some questions and really struggling. And so eventually my family did end up leaving this church, specifically when they created a policy that children of gay parents couldn't be baptized. And that was just kind of the beginning of the end for me, where all of these things that were happening just didn't make sense with what I felt like I had been taught growing up. And so we ended up leaving. And then in 2018, I saw a need for community, people who were being kind of kicked out or forced out of their communities that they grew up in, just all different kinds of religions, and not having a safe place to land. So my husband and I helped co-found a community group called Rainbow Circle. Initially, it was created to provide that safe space for LGBTQ adults who were kind of forced out of their conservative religions. And it's grown into something a lot bigger now. And so, yeah, that's kind of my story and how I got started as an advocate.
Okay. And I didn't know that about Rainbow Circle, because I've seen them and I'd heard of them, and I didn't know that you and your husband co-founded it. That's awesome.
Yeah, we helped with Amy and Debbie are the other co-founders, and so we helped start that back in, I think it was September of 2019, so right before the pandemic started.
Okay, so what brought you to Boise?
So growing up in Burley, you can't stay there once you graduate. There's not a whole lot. So everyone from Burley either went down to Utah to the Salt Lake area, or they came up to the Boise area. I ended up in the Salt Lake area. My husband, who was not my husband at the time, he ended up in the Boise area. He's a Boise State grad. And we both grew up in Burley, same hometown. We kind of started dating long distance and eventually got engaged, and one of us had to move, and he was the one that had a job. So, yeah.
So of course, and
Yeah.
so here you are. So
Yeah.
what
So
are
I've been here for 24 years now and absolutely love it. I can't imagine being anywhere else. So
That's awesome. So what are some things you were passionate about improving within the community that showcase pride?
yeah. Okay. So some of the things, actually, probably the biggest thing I'm passionate about is healthcare. And especially when it comes to LGBTQ and transgender patients, there's a lot of bias in medicine anyway. There's a lot of bias that most people have to deal with. And then people who are LGBTQ and trans have so much more bias that they are having to deal with, just with different reasons: healthcare bias, lack of healthcare education and training, insensitivity from healthcare providers, and just plain ignorance. And so my big thing is helping make sure that there is a safe community um, in within healthcare for patients who are LGBTQ and trans, just because it's really difficult to navigate the healthcare system. As a healthcare provider, it's difficult to navigate we have a really complicated healthcare system. And so trying to navigate that while trying to find kind, affirming providers is just difficult. So my one thing I'm just passionate about is finding other healthcare providers that I can work with, refer patients to, who are affirming, who my patients have a really positive healthcare experience with. That's my goal.
Yes, yes, of course. So what made you choose to go into healthcare?
Yeah, so I knew, okay, so I did school a little bit later in life. I was really good. I was a really good Mormon. I was a stay-at-home mom when my kids were young. I did all those things. I knew my plan eventually was to go back to school once my kids were old enough. So I had an experience where my youngest was, when he was born, he came 9 weeks early. And so I got to see upfront healthcare in action. And one of the things was seeing how great the nursing staff and the physicians and the healthcare providers are, and then also seeing the opposite, and having to request to have nurses not on our son's care because of just because of a bad experience. And so being able to see that up front actually was very helpful for me to be able to go, okay, I see things that I really like, and I've seen things that I really don't like, and why I don't like them. And so that's actually been really helpful for me to be able to be a better advocate for my patients and also be a better healthcare provider for my patients.
I love that. I love that. So what exactly is hormone therapy for transgender patients? You see a lot of things in the media, and I'd love to be more educated. So
Yeah.
tell me more about it.
Yeah. So our clinic only does hormone therapy for adults. But what a lot of misconceptions in media is that we are pumping little kids full of testosterone. That's not what's happening. So for children before they hit adolescence and before they hit puberty, what they use for adolescence is puberty blockers. But like I said, we don't do that in our clinic. We don't work with patients under the age of 18. Just with Idaho law right now, and because it is a little bit more specialized, that is better to be done with the pediatric endocrinologists. So the pediatric endocrinologists are the ones who manage more of the transgender care for patients that are not adults yet. But for adult patients, all the therapy is going to be very dependent on the patient's goals. So that's one of the first things that we discuss is what are their goals of therapy? What are they hoping? What are they hoping for? What are they hoping to have done? So we have patients who are transgender males, transgender females. I have non-binary patients that are on hormone therapy. So it all depends on the goals of therapy. But in general, for transgender males, it's going to be testosterone therapy. And then we check labs. We get a baseline of what their labs are before starting therapy, and then we monitor throughout therapy. So in the first year, we monitor the labs a lot more closely. And then after everything is stable, then we monitor less often. So about every 6 months. For transgender females, the hormones that we typically use are spironolactone and then estradiol. So, and it all depends on patients' goals. And so that's something that I make sure all of my patients understand. They are the ones that get to say, hey, I really like how my body is right now, or hey, things aren't progressing as quickly as I like. Is there something else we can do? Can we, so when we're talking about increasing doses, lowering doses, we have conversations every single time.
So it's very like medications that we might receive when we're in menopause. Like, I mean, from what I'm hearing, not that I'm in menopause or close to 50, but
absolutely. I was going to say, that's actually another thing that we do here is we do perimenopause and menopause hormone therapy. So absolutely. And getting comfortable with hormones, I think, is something that most healthcare providers should do. There's a huge lack of healthcare providers that are willing and able to prescribe hormones. And so then we get patients who are trying things on their own, who are using mail order pharmacies or using, I'm pretty sure there's information for transgender patients on how to, like, which pharmacies they can get stuff online. That is a less safe way to do this. And so I definitely recommend seeing a healthcare provider just to be able to watch your labs.
Oh, of course. I mean, why would you want to do that without someone? I mean, I could understand if you're going through a transition and you don't have a supportive provider, but we need that kind of healthcare. And
I absolutely understand why patients do it, though, because trying to find providers who are willing and able to prescribe hormone therapy, first of all, can be difficult. And then having healthcare providers that require 6 months of seeing a therapist before they'll start hormone therapy, or making, there can be a lot of barriers to care. And so I absolutely understand why patients do that.
Yeah. Yeah. Well, how nice that they have the alternative that they can come see you and get that care. So what is restorative medicine and how does it help your clients?
Okay. So how I like to look at restorative medicine is it's more of a whole body way of looking at health and wellness. So when I'm looking at a patient, I'm not just looking at, oh, here you have hypertension or high blood pressure, here's a medication for you. We get into, okay, first of all, let's do some education on what hypertension is, why it's a problem for your health, how it impacts your body, so that you can make a better decision on how we're going to go forward treating it. And then we discuss lifestyle modifications. So things like lowering sodium in your diet, increasing potassium, other supplements that might be beneficial, ways to reduce stress, because stress can be a huge driver of high blood pressure. And then we will talk about medication if it's needed. But there are other things that we can do first, other approaches. And so looking at restorative medicine, we don't just look at the patient and prescribe a medication immediately and then, see you in 3 months or 6 months. It's let's get into how this is impacting your health, how it's impacting your life, because there's a lot of health conditions that do have a huge impact in people's lives. So we're not just looking at one thing, we're looking at the whole person. And then also trying to figure out the best way to help that person. So for some people, it might be lifestyle, stress reduction, it might be a combination of some other things. And then for other people, it might be that, hey, we do need to go the pharmaceutical route. And so here are the different options. Let's talk about the pros and cons of different options. And then let's work together to create a plan. And so that's one thing I really like to do, is tell my patients that they're the ones in the driver's seat. They're the ones that get to make the decision about their body. My job as their healthcare provider is to provide them with the education to be able to make the best decision for their life, for their health, and for what their goals are.
I love that. So how is Mangum Primary Care different than other primary care clinics?
Yeah. So first of all, it's different because when people walk up, and you came here, so when you walk up, it's just a beautiful environment. It's really relaxing.
Really beautiful.
Yeah, it's just a nice, relaxing space, soft music playing in the background. So when they come in, they don't have an MA or someone that's checking them in. They just check in on an iPad, and it alerts me that my patient's here. And then what I like about not having a huge front office staff is that I get to spend longer with my patients. And so most patient appointments are usually 45 minutes to an hour. So for first patient appointments, they're always going to be an hour long. And then, so we have longer patient times. And then we also, all of my patients have direct access with my cell phone. So they're able to text me if they have questions. They'll, it's just a nice way of being able to really quickly communicate with patients.
I love that. I saw that on your website too, that you've got your cell number with text right on it. So that's amazing. So how do you offer a safe space to land for LGBTQ patients?
Yeah. So I think the big thing is just allowing the patient to be themselves. I'm not asking for them to be anyone other than who they are. And when they come in, they are accepted and affirmed with whatever their gender identity, whatever their sexual identity is. They're affirmed and not expected to change. So just being able to come in and be yourself in a place, I think, can be a huge difference for a lot of people, and not have to hide who they are.
Especially now, and with all the political unrest and everything that's happening.
Yeah, absolutely.
So that wraps everything up. Is there anything you wanted to share? Any last words you wanted to say to anybody out there looking for affirming healthcare?
Yeah, let me think.
Or just any healthcare in general.
Yeah, and that's the thing. So we do transgender healthcare. We get quite a few patients who are LGBTQ, just because our environment is a little bit different and less Idaho than some other places.
Less Idaho. I'm sorry. It's true.
Just politically, we're a little bit different than other places in Idaho. So this is a really safe place. When I was in school, so Meredith, the owner of this practice, she's been my healthcare provider for more than 7 years. She came and started this clinic about 2 years ago. And so I switched with her when she moved. And so she's been an amazing resource for me. And anytime I would have friends who are LGBTQ, I've sent them her way, because I knew that she would provide a safe, affirming place, and I was never wrong. And those patients started sending their friends and family members her way. So when she offered me a position to come and also work with her, I jumped at the chance, because I knew that I would be able to practice the kind of healthcare that I wanted to, and not be required to see, 22 patients in one day, and, seeing a new patient every 15 or 20 minutes. So that was the big thing about coming and working here. And then also I have children who are on the LGBTQ spectrum, and being able to have a healthcare provider that kind of understands the family dynamics, and everything that entails with that, I think has been super helpful. And then also to have a primary care provider that doesn't just do, one part of your healthcare, but can do all of it, or at least all of it to a point until if and when we have to get specialists involved, but who can do all primary care stuff, has been really nice for a lot of my trans patients.
That's nice. That's nice. Well, thank you so much for tuning into Pride Pages podcast. Don't forget to subscribe and follow us. And if you want to reach out to Dr. Becky Gomez, her phone number is below, and I will also put links underneath that you can grab and reach out to her. So thank you so much for being here with us. I
Awesome.
appreciate
Thank
it.
you. Yeah, thank you so much.